Here, I gotta look in your ears, and I'm gonna make you mad.
A child can pick up an ear infection virtually anywhere, and it often occurs as the result of another illness, such as a cold. The virus spreads to the middle ear, causing painful swelling, as well as trapping fluid and mucus inside the eustachian tubes. Those are the tubes that keep air pressure stable in the ear. It sounds pretty serious, but this isn't the time for worrying just yet.
Most frequently, it comes and it goes on its own. And most times, if a doctor is involved with it, what they're going to do is they're going to wait for a certain length of time that they feel is appropriate just to see if it clears itself up, because most of the time it does clear itself up.
The next step, should the infection stick around for a while, would be the use of antibiotics. Your pediatrician might also prescribe a pain reliever for your child. However, with some children, like little Addie here, the fluid buildup from the swelling in the eustachian tubes can become a real problem.
Addie's eustachian tube did not drain properly. So what happened is it would just sit there and it would become infected. The fluid would become infected, therefore causing a horrible ear infection.
Addie's doctor prescribed antibiotics, but the problem never went away.
Addie had 4 ear infections by the time she was 8 months of age, which at that point you just know you have to get some antibiotics are not going to fully treat her ear infections.
Here's the problem. The eustachian tubes are smaller and straighter in children than in adults. This makes it more difficult for fluid to drain out of the ear and could lead to even more serious issues.
As you can imagine, if you've got fluid in that middle ear instead of air, it can muffle the sound, and that can cause hearing problems. And with little children who are trying to learn speech and language, you don't want to have muffled sound.
In Addie's case, it was time to take action. Tiny tubes were placed through small openings in her eardrums to relieve the pressure from the ear infections.
I went into it thinking it can only get better. It can only get better from getting these tubes and help that fluid drain. And we saw immediate results. Within 2 days, she was sleeping, she was happy, she was not as irritable.
The tubes eventually fall out on their own, but while they're in, you need to be extra protective at swim time or bath time. Earplugs will do the trick.
Oh, you're going to put them in. Here, try this one.
With ear infections, as common as they are, parents should really watch out for these telltale signs in a child. Unusual irritability, difficulty sleeping, tugging or pulling at one or both ears, fever, fluid draining from the ear, loss of balance, or difficulty responding to quiet sounds. And parents, keep in mind, secondhand smoke is another contributing factor to childhood ear infections. So if you needed yet another reason to kick the habit, there you have it. For the Hees family, quick response to the signs of Addie's ear infections made all the difference.
It was wonderful. It was almost like we got our life back. And when we got the tubes placed, it was a whole new world. It was a world of happiness, relief, excitement, because she felt better. I mean, Addie truly felt better.
The sound of a healthy child. That's all any parent truly wants to hear. For Smart Medicine, I'm Lorraine Cachola.